This is Libby, and here's an episode with just some extra content which is not compulsory for the exam but could help you achieve those higher marks. It's talking about Islamic advances in medieval medicine. The Islamic Empire, which was prominent in the 8th and 9th centuries, was more scientifically advanced than Western Europe. They preserved lots of books from ancient Greek and Roman scholars like Hippocrates and Galen. As a religion, Islam was disposed to furthering scientific discovery. This was because the Quran supported scientific research and learning. Key Muslim doctors included Avicenna and Ibn al-Nafis. In the 10th century, Avicenna wrote an encyclopedia of ancient Greek and Islamic medicine called Canon of Medicine. This was vital in Western Europe until the 17th century, after it was translated into Latin. Key Muslim doctors included Avicenna and Ibn al-Nafis. In the 13th century, Ibn al-Nafis claimed that Galen was wrong in his belief that blood was produced in the liver and that it fueled the body. He thought, correctly, that blood passed through the heart via the lungs. But Islam banned human dissection, so al-Nafis could not prove his theory. Because of this religious belief, Galen's mistakes were believed until the 17th century. Alchemy tried to turn metals into gold and find a substance that gave eternal or never-ending life. Alchemy was used in the Islamic Empire, and alchemists did use things like distillation, which helped the development of drugs. So let's just recap on alchemy and what we've just learned. So first of all, we know it helped the development of medicine. It also involved trying to turn metals into gold and trying to find a substance that gave eternal life. Alchemy was also used in the Islamic Empire. So we've just learned about two key Muslim doctors. First of all, Ibn al-Nafis and also Avicenna. Islamic surgery and reaching the West. The Islamic Empire, which was prominent in the 8th and 9th centuries, was more scientifically advanced than Western Europe, as I said before. Alchemy, the Islamic physician, wrote a detailed book on amputations, fixing or stitching wounds, fractures, dislocations, and dental surgery on teeth. In the 11th century, Alchemy wrote Al-Tasrif. This was a 30-volume book on medicine. He also invented surgical instruments and popularized cauterization. Muslim hospitals were far more developed than Christian hospitals, because they actively sought to treat patients. They had isolation units for patients with contagious illnesses. There is some evidence that surgery was more advanced in the Islamic Empire and that doctors did post-mortems on the dead. Islamic medicine and their knowledge of ancient Greek medicine began to penetrate the Western world in the 11th century. This was after a merchant, Constantine the African, arrived in Italy. The transfer of knowledge, however, was very slow. Trade routes were important in spreading information between civilizations. So, what have we just learned about Islamic surgery compared to medieval times? So, we know that Muslim hospitals actively sought to treat patients. We also know that Alchemy invented surgical instruments and popularized cauterization. And also that Muslim hospitals had isolation units for patients with contagious illnesses. So, we know that the importance of Islamic doctors was that they also potentially did post-mortems, which suggests that their medicine could have been more sophisticated than in Western Europe. And to recap on alchemy, this was when people were trying to turn metals into gold and find a substance that gave eternal or never-ending life. Alchemy was used in the Islamic Empire, and alchemists did use things like distillation, which helped in the development of drugs. So one important thing was that Islamic medicine to spread knowledge throughout the rest of Europe. So we know that trade routes were important in spreading information between civilizations. Also that penetration began after Constantine the African, a merchant, arrived in Italy. We also learned that Islamic medicine and their knowledge of ancient Greek medicine began to penetrate the Western world in the 11th century. So Avicenna was one of the well-known doctors in Islamic medicine, and we know that he wrote a book called the Canon of Medicine in the 10th century. Sorry, I made a mistake there, which you can see. So the Canon of Medicine was his encyclopedia of ancient Greek and Islamic medicine, and it was vital in Western Europe in the 17th century, after it was translated into Latin. So that brings this entire course to a close. I hope you enjoyed listening to these episodes, and thank you very much.